the WISHIN 2.0 Transition Business Overview. We are excited to share with you several updates, enhancements, and new features as an outcome of the hard work and dedication of many throughout this transition process. My name is Steve Rotman, Chief Operating Officer at WISHIN, and I will be the moderator for this afternoon's webinar. Please know that this webinar will be recorded and available on WISHIN's YouTube channel. All attendees have been placed in a mute. So if there are any questions, and we encourage questions, please submit those through the GoToMeeting chat feature on the top right of the GoToMeeting window. Additionally, all questions will be posted to our WISHIN 2.0 webpage. Today's speaker will be Laura Witter. She is WISHIN's project director, and she will provide a brief overview of WISHIN 2.0, describe how WISHIN will be in a better position to integrate within participant workflows and EHRs, highlight some of the new features and functionalities, and update all on the participant transition process. So again, thank you for joining, and I'll now hand it off to Laura.
Thanks, Steve. So as Steve mentioned, this webinar is focused on the business side of the house. So we'll be talking about features that are available for users, and also covering some of the enhancements we'll be making to WISHIN 2.0. Tomorrow we will be having a webinar that is focused more on the technical side. So that will cover a lot of the technical details surrounding our transition to WISHIN 2.0, including the transition process and new features that will be available that you can take advantage of, like FHIR and different ways to do CCDA exchange. So as I mentioned, we'll do an overview of WISHIN 2.0. I'll highlight some of the new features, things that users have been asking for in the past and that we can now deliver. And then we'll go through the process for transitioning users over to our new system. So WISHIN 2.0, it will have all of our products and services you've come to know and trust, but it will be better. We are still under a reliable, high trust infrastructure, and our systems will now be built in AWS. We have best of breed patient matching. We're capable of handling new data sources, such as social determinants of health, claims data. We have a comprehensive inbound and outbound capabilities for HL7, CCDAs, FHIR, API, third-party applications, ingesting flat files more directly. And we have a redesigned WISHIN Pulse community health record with some built-in analytics right off the presses. We are also going to be parsing CCDAs and have a new super CCDA that will be available. There's some new SSO capabilities, single sign-on, from your EHR to the WISHIN Pulse system. This system will also offer additional support for quality initiatives and more analytics. This is just a picture of our hybrid relationship. We have partnered with two vendors, Velatura and KPI Ninja. Velatura is handling the data manipulation piece of this, the data, receiving all of the data, managing the CCDA process, also managing this direct secure messaging process. They will do the patient matching and any kind of routing that we need of messages outbound. And then KPI Ninja will be handling the community health record side of the house. They'll be dealing with the super CCDA, making it available to people in the WISHIN Pulse system. They'll be handling the single sign-on, patient activity reports. We will be working for NCQA certification for payers for quality measures. Also advanced operational reports, consent management, and the analytics piece. So you can see the data will come in to Velatura. Velatura will transform the data as needed for KPI Ninja to manage it in the community health record. And Velatura will also be routing the ADTs over to patient ping and also do any public health reporting that we have with our customers, like syndromic surveillance and immunizations. And then on the KPI Ninja side, that'll be the user interface. That'll be what you'll be logging into to view the patient community health record. We'll still have the links to the Wisconsin ePDMP and the Wisconsin Immunization Registry, but they'll be easier to find, as you'll see. With this new architecture, we have expanded capabilities, and we're very excited about this. We have increased ability to incorporate new use cases and emerging technology. We're going to be FHIR ready for advanced EHR integration possibilities. We have a modular design and a greater ability to integrate with external systems. We can offer powerful message routing and push capabilities. I'll show you some enhancements we're doing to CCDAs. Our SSO options, and the robust analytics capabilities that are available with this new architecture. As an example, one of the great things about this new architecture is the ability to react very quickly to customer needs. For example, KPI Ninja during the peak of the COVID-19 outbreak created dashboards that were available for its customers that they could easily see COVID-19 status of individual patients and also aggregate information. You can see lab reports and an individual COVID-19 profile for patients. So just as a reminder, data available in the WISHIN Pulse system, we are still going to be having all of this data available. ADT, which is admission discharge transfer, that is the patient's visit history, their problem list, allergies, diagnosis, demographics, insurance information, laboratory and pathology results, the care summaries or CCDAs, Medicaid prescription fill data, and also payer medications. That is in progress. And we plan to have quite a bit of that available in our new system. ePDMP integration, radiology reports, transcribed reports like history and physical, clinical notes, discharge summaries, those types of documents that used to be transcribed. EKGs from customers who are sending us the actual EKG strips. We are still going to be integrated with the Wisconsin Immunization Registry. And something that's new, if you've missed it and haven't heard yet, for our payers, or from our payers, those who are, for their members who are receiving SSI benefits, they are submitting their care plans to WISHIN. So you can now see payer care plans in our community health record. Some new features. Some of these have been requested by our customers. We've responded to emails. We've heard it in training sessions. We've heard it in our seminars, these new features that will be available. So first of all, I talked about update the single sign-on capabilities leveraging new technology. That technology is currently supported by many of the EHR vendors, and we know that other vendors will be supporting it around the first of the year. For those whose vendors don't currently support this new technology, Meditech is one in particular, we will maintain the legacy single sign-on functionality for a limited amount of time until those EHR vendors are ready to leverage this new technology. One thing that has been asked for quite a bit is easier access to the prescription drug monitoring program. So now we have one-click access to the ePDMP. You log into the WISHIN Pulse system. When you look at your patient, you have a section of quick links. You'll be able to click right there to the ePDMP without having to navigate through several tabs. Same thing with immunizations. There'll be a one-click access. We also have alerts now. So if there are areas of concern, there will be alerts right on the front page of that patient and one-click access to get to those types of alerts. For our friends, especially for EMS users, we have added more ways to find patients. So first is search by admission records. This is especially pertinent for EMS organizations, if they drop off a patient and have to finish up their paperwork, but they had a John Doe, they don't really know who the patient is, they're able to search for the admissions by the facility, a date, and a time range so that they can easily find that patient. Also, there's a search by address, so you can enter a street address along with the city, state, and find patients that are at that address. There is a My Patients list. This list is something that has been requested by many users to help avoid having to search for patients every single time. If you have a patient you're working with frequently, you can add that patient to, quote, a favorites list, unquote, where you can click on that list and easily track what's happening with the patients you're working with. You can see it has the patient information. It'll have the date of the last ED visit, the last inpatient visit, the last outpatient visit, and then also has some counts. Counts of how many ED visits they've had, inpatient visits they have, how many chronic conditions they have. And then you can click into their community health records from this list. We're offering some cool trending and timeline views when you're looking at patients. On here you can see that for Jane Doe, we have a timeline view of her patient visits for different types of visits. We have emergency visits, outpatient visits, and inpatient visits that will be automatically plotted on a timeline. We also have some miniature trending views when you're looking at different lab tests. You can see how the trends are going and whether something is flagged. The last lab was flagged as abnormal. You can get into more detailed trending views for various test results and vitals. You can see here there's a trending view for BMI, blood pressures, A1C, LDL. Then we'll also be offering expanded analytics and dashboards. This is something that's really exciting as well. Phase 1 will have a set of standard dashboards that are going to be available for users. Then in our second phase, after we're finished with the transition and moving forward towards optimization, we are going to be able to create some custom dashboards and reports for individual organizations, or we can create even more dashboards that are available for across communities. Another exciting piece for our next phase will be disease management dashboards. And then some CCDA enhancements. We are going to begin parsing CCDAs into the community health record. So key parts of the CCDA will get parsed and put into the community health record along with the rest of the patient's HL7 data or data that's coming in through interfaces. Mainly that'll be medication lists. So you'll have a deduplicated medication list from any of the CCDAs we have on file from our customers. You will also get deduplicated allergies and any other data that we can deduplicate, vitals perhaps. And then also the ability to create a, quote, super, unquote, CCDA. The super CCDA, many of you may be familiar with the create community document or create care summary functionality in our current system. This takes it a step further, and it will combine both the HL7 data that was in the record or in the community or the care summary that you were previously able to create, but also add the CCDA data in so you have one record for everything and it's deduplicated. Of course, with those super CCDAs, they contain those discrete data elements that are ingestible into your EHR system. So if you have an automated query and retrieve, you can get the super CCDA in that automated query and retrieve, and it'll be just like other CCDAs. All of it is discrete and ingestible. And then we're also going to allow you, if your organization wants, when you do a query for CCDAs automated, you'll be able to have that query also go out to eHealth Exchange connections and pull data from the eHealth Exchange into your query and the documents that are returned. We are still also going to have the eHealth Exchange available in the user interface, the community health record. It'll be easier to get to and also easier to get the data out of those connections like the VA. Even more new features. We will have better operational and audit reportings. So you will be able to, for user administrators, they'll be able to create reports of all their users and all the user settings. There will be a larger variety of audit log reports available for privacy and security audits. The user administration is going to be simplified as well. First of all, there's the ability to batch import groups of new user accounts. We have easier to use templates and role assignment for user administrators. So the setup doesn't take as much time and it's also much more streamlined. And there is the ability to allow email notifications to users. So if you want in your organization, when we set up users, if you want those users to receive an email with their login information, we can auto-generate those types of notifications. Going into the transition process, our goal is to have our transition complete by the beginning of October. And so we will need to transition your users from the current system to the new system. First of all, for single sign-on, if you have single sign-on from your EHR system, we have reached out to technical contacts at your organizations and informed them of the transition and have been explaining to them when they can begin building and testing the new single sign-on, and also sent single sign-on specifications over to them. Also, if you don't have single sign-on and would like to explore adding that, feel free to reach out to WISHIN. We can add that. But we'll be working with your technical contacts. On the technical webinar, we'll talk a little bit more in depth about how the new single sign-on works. But from your EHR's perspective, you really shouldn't see any change as far as how you're accessing the WISHIN Pulse system. If you have single sign-on from patient to ping, WISHIN and patient ping are working together to build the single sign-on to the WISHIN Pulse system. So again, you won't really see any changes inside patient ping. You'll click on the same links and then it'll open up the new WISHIN Pulse system as opposed to the current one. And if you do not have single sign-on, we will reach out to your organization and ask you to review your current list of users. We want to make sure that it's accurate. We'll ask you to remove any users who are no longer with your organization in case that hasn't been kept up to date. Add any new users that should be added to a spreadsheet, and then we'll batch import your approved list of users into that new system. We will be providing training for users. We're going to hold a series of online training sessions a little further into September. And then we will make recordings of training sessions available. So if you miss one, don't worry, we will have recordings of them available. Also, if your organization has special use cases, we can work with your organization to schedule training specifically for your organization. So we do have some groups that do have special use cases or limited access, and we'll work with you to make sure that we're covering your use cases. We'll also provide user administration training for those who will do, who will administer users in the system. WISHIN will do the initial user setup into the new system, but then we will train you how to maintain those users. I did kind of breeze through that webinar, so we do have plenty of time left over. Steve, did you want to address any of the questions out loud or anything like that, or was there anything you'd like to add that I may not have covered?
At this time, there are no questions, but why don't we take a few minutes to talk about the capabilities of data integration and how that can streamline into a clinician's workflow.
Steve, did you want to address that?
If you could, please, talk about those, going back to the data integration slide. While we're doing that, we do have a question. Will transcribed reports be available to payers as they have not been in the past? So transcribed reports that are sent to WISHIN are available to payers. Courtney, if there's a specific organization that you're looking for transcribed reports from, that might be a question of, are those is that organization, or are those organizations sending the transcribed reports through the transcription interface? That capability is available again, and we do find health systems and hospitals contracting to onboard that data here after the transition closes. So you will see more transcribed reports Q4 into 2022.
And Steve, was this a slide?
Yeah, so with the expanded capabilities to integrate with an EHR care management system, maybe an EMS system, etc. As it states here, we are looking at a fire ready that is rich in fire resources, but those fire resources available once the transition completes is not going to be the limitation. So if there are specific data elements individuals are looking to bring in rather than an entire CCDA, being able to move data discreetly, but intentionally based on what an individual might need. Maybe a specialty of a dermatology is interested in specific information, or cardiology. There are fire resources available for that, care management, etc. And what you'll hear tomorrow in Laura's technical overview is that in relation to the information blocking rules, the data will be structured and available in the US CDI standard. So there's a lot of work that goes into identifying the data elements we have and restructuring it so it moves in accordance with the standard. So as folks are looking at the information blocking rule and might have questions from their IT or HIM departments of how WISHIN can be used from a US CDI perspective, information blocking, and resolve those needs or concerns. And in addition to that, wanting specific data elements, these things will be coming as part of the WISHIN 2.0 transition. The other routing and push capabilities involve movement of lab data, ambulatory or clinic data, being able to push that to an individual or a group. Those enhanced capabilities, in addition to the patient activity report and our partnership with Patient Ping, we want to meet you where you are and provide the capabilities to access information at the right time for the right individual that is, again, intentional to the care and treatment of patients and management of our health plan participant members. Any other questions? Laura, thank you for answering that one. Laura, could you talk about the access to the PDMP? Can you bring up that slide and where there's a single connection? And as far as the capability or the new functionality rather to payers, these solutions will not be limited to a participant type or another. Health plans, health systems, our ambulatory participants, EMS participants, post-acute, they will all have access to this new functionality, and we can share with you again the My Patients list and how that might be very helpful to care managers as a health plan participant, able to access a cohort or a population rather than individual patients or members.
Regarding the Wisconsin Enhanced Prescription Drug Monitoring Program, or the EPDMP, one piece of feedback we received from our customers with our current system is that it's a little complex to get to. Many times that's the first thing users want to check when they get into the community health record. So we did place it as a quick link on the first page of a patient's community health record. When you click on that, it will open the EPDMP system in a new window and go right to that patient. It'll be the same kind of integration we have now, where you do have to have a login at the Prescription Drug Monitoring Program in their portal. You do have to have an active login. The first time you do the link, you will it will pair your user ID in our system to your EPDMP user ID and have you confirm that with the password for the EPDMP. And then after that, it'll always just be a one-click access to that patient, whatever patient you're viewing. Now, the EPDMP is only available for prescribers or people who do have permissions to use the EPDMP system of the state, and it is a separate service. So if this is something you are not currently using through WISHIN and want to have more information about how to use that, please reach out to us. We can talk to you about what it takes to add that EPDMP service. Immunizations, that is not an add-on service. That is available for all users. So again, it is a single click, and what happens is when you click on the immunizations link, our system will go out to the Wisconsin Immunization Registry and pull the vaccine history and immunization schedule for the patient. It does include up-to-date immunizations from WIRS, so it does include COVID immunizations. The other quick link is the list of participating providers. That was always available on the bottom of the WISHIN Pulse system. You click on that link, it'll open up to our webpage and show you who's all participating in WISHIN. In the event you were wondering who is submitting data for these customers. For the alerts, we have just designed some alerts to show up right on a patient's basically profile page, so that you have quick access to that information. So if a patient does have allergies with a reaction listed as severe, we'll have an alert so you can click right away down to the allergy section and see what those severe allergies are. If they've had a readmission within the last 30 days, you can click on that. It'll take you to the patient's visit history. If there's an advanced directive that we have on file, you can click a link to that. Same thing for labs. If there is a lab with an abnormal result, we will have an alert, and you can click on that to go to the list of labs to see what labs have abnormal results.
And a couple more questions have come in, and I'm typing those in the chat as a response. But to Lori's question, will the information blocking, for the information blocking purposes, will the US CDI elements include notes as required by the information blocking rule other than psychotherapy? And yes, we're looking at the entire US CDI specification and newly released version 2 for all the data elements that would need to be available for information blocking rule, for the information blocking rule, but also for the seamless exchange and what brings the greatest value to the participant. So what's driving this is not only the information blocking rule, but definitely an aspect of the exchange of this data. To the question from Judy, what SDOH data will be available, or what data will WISHIN 2.0 be able to handle, rather. We are looking at accepting, and we currently do see a lot of SDOH information available in provider source CCDAs. There's a section for social history, and so we, as Laura mentioned, we're going to be able to parse those CCDAs and extract that discrete data to be made available within the community health record and super CCDAs, but also within the HL7 feeds, primarily the ADT, there's ICD-10 and Z codes that we will be able to pull out and make available, and it will drive that data in addition to any partnerships or data we might receive from a NowPow or Healthify or Aunt Bertha. There's some conversation happening of how we create bidirectional exchange and integrate with those systems so that we're not creating silos of data. We are agnostic today with EHRs and EMRs or however else organizations can send us data, and we want that to flow seamlessly. For the exchange and use of SDOH data, in addition to just exchanging it, as Laura mentioned, we can use that data to notify and push those notifications as part of a closed loop referral network. So where there's community-based organizations, we can wall off sections of the community health record so that food banks, housing, et cetera, would have access only to social information specific to a patient. So if there's more information you'd like, Judy, we can unmute and have that conversation here. One thing I missed as part of the social determinants data is anything that is made available to WISHIN as part of the care plan submitted by health plans or payers. Today, a number of MCOs are sending their care plans, and now we can pull that data out and leverage that data. And I guess to close that point, we talked about bidirectional exchange to other partners or SDOH specific vendors. We do see that as a bidirectional exchange. And so any information that we might have that helps those users of those systems, we can have a bidirectional exchange from WISHIN to those systems and power analytics on top of that. Christy, are there advanced directives now available in WISHIN? Not to our knowledge do we have advanced care planning documents or advanced directives. Those are sent to us today in the transcribed reports. Laura, please correct me if I'm wrong, but that is an initiative we've had for some time and had a number of conversations. Again, as the transcription interfaces continue to grow, and as an incentive through the P4P incentive payments for measure year 2021, we are including the transcription interface onboarding at no cost for those organizations expanding their contribution to WISHIN. So over time, we do see advanced directives coming in, and an opportunity to talk to specific organizations or companies that deal with ACP exchange. And we've been in contact and had some conversation with the state folks about how to exchange that information as well. Laura, anything to add with advanced care planning documents or advanced directives?
If your organization wants to start sending them, if you have them on file, reach out to us and we can talk about the best way to receive them. It would have to start after our transition is complete, but we definitely do want to have them in our system and available for other healthcare providers. So we can definitely have a discussion about where they should be included, what interfaces, how you can submit them, how you have them on file in your own system.
Yeah, we definitely see the value in having advanced care planning documents as part of WISHIN Pulse. It's a single source, emergency rooms, EMS, et cetera, having access to that documentation rather than requesting it, or maybe it's on a card where folks might be able to find it. It's right at providers' fingertips. That's a great question. Alice had a question, or two questions here. One, will we be able to pull reports based on alerts, such as a list of our members who have completed advanced directives? Yeah, there will be more population-based functionality that's available, and should caveat that to within the confines of our data sharing participation agreement and accepted use cases. So long as the data can be exchanged, then we want to leverage our hybrid environment with Velatura KPI to provide the functionality to report or have an analytic dashboard for you to access. That would be also conversation about immunization status. How many of your patients are immunized? I mean, that's a conversation we're having. So similar type of reports or dashboards. The analytic capabilities are really endless once we get to a point here in the next few months. And we'd love to work with you, and we are going to be very intentional about reaching out and understanding what are the opportunities that exist for your organization, and maybe some struggles you might have. Is it possible to pull ADT reports from this platform instead of accessing Patient Ping? Our partnership with Patient Ping will not end as a consequence of this transition. It may strengthen, but the ADT data that we'd be able to provide, again, would be extended to ambulatory, correctional, behavioral health, et cetera. So again, our partnership with Patient Ping will not end. And we're looking at, again, a solution that meets our participants' needs. So power, how do we make the solution meet your needs? And as Laura mentioned previously, those notifications from Patient Ping or the solution, the portal itself has a single sign-on into WISHIN. So how we can best leverage those notifications to push more information to you. What are the ways? So what are the ways in which you can send data to other systems, CCDAs, flat files, FHIR? So we talked about that briefly, and happy to dive in a bit more. Through the FHIR resources, we can create the APIs to your systems, but it doesn't have to be limited to FHIR. We can do flat files or CSVs. We can do CCDA exchange, and I'll leave that up to Laura to dive into again a bit deeper. But the platform will be nimble and available to move data, and that's where we've been handcuffed in the past, is limitations on how we can move data, and we understand that these resources are available and we need to start leveraging. So if an organization is FHIR ready, or we can provide some of those FHIR resources to you and create a platform through our partnerships with Velotura and KPI Ninja, we will be in a better position to do that. Laura, did you want to talk about the CCDA integrations that are available again?
Sure. This will be covered more in the technical webinar tomorrow, but with CCDA Care Summary Exchange, we support providing CCDAs via all of it's covered by IHE profiles. So we support providing CCDAs to WISHIN via XDSB. The CCDAs are provided through ITI messages, and they do have to have the accompanying ADT with them. The ADT interfaces, which is the admission discharge transfer. What the ADT does is it registers the patient in our document repository, and then the CCDA gets linked up to that patient. Then on the flip side of that, we support ways to query and retrieve CCDAs automated. So for health systems, for example, what we have set up so far is healthcare organizations in their EHR systems, if they register a new patient, they automatically kick off a query to our system, and it will query for the patient and pull back all of the CCDAs that are available for that patient. Some EHR systems have a manual integration where you can click a button and request the CCDAs from us. It all depends. But behind the scenes, they're using what's called IHE profiles, and the messages are they're ITI messages. And there's two ways we can support queries: through XDSB again, which is one type of a protocol, or another one that's called XCA, XCPD, which is more of a cross-community type exchange. So each of them have their intended uses. The cool thing about our new system is when you do an automated query, You can either get the stable CCDAs that were sent to us from our customers, or you can get a super CCDA. And the super CCDA will be a combination of all the CCDAs we've received plus any of the other data that's in our community health record. And it is deduplicated and organized as discrete data, so you would get one document as opposed to several. Of course, depending upon whether you've added a date range parameter to that query, that could be one very large document, but it is discrete and ingestible into an EHR system. They're basically XML documents. There was one other question on here from about, is there a way to find out when systems are sharing more or any information? A couple of ways. Number one, subscribe to our newsletter. Our newsletter will always have who's new in our system and what new information is being sent. Number two, we do have a website, as I mentioned, of our participating providers. When you click on that, you're able to see who's participating in WISHIN. We're working on not just the who, but what are they sending. And then the third way, which will be very neat, is the WISHIN portal, the WISHIN 2.0 homepage. The portal page itself, where you log in, we have a spot where we can put announcements. So when you go to log into the system, we may be able to post an announcement that these customers are live with data, or we have these new customers who are sending data, and can say what kind of data they're sending. We can have those types of announcements available. It'll also be nice because at that portal page, if there is, hopefully there won't be, but if there is an outage with the PDMP, or if immunizations are down, we can have an announcement right on the sign-in page, so you know right away if something like that is not working.
Any other questions? We'll work to, again, the questions that have been brought up here have been great, and we appreciate the conversation here. We'll pull all these questions and update our WISHIN 2.0 webpage, the frequently asked questions section of that webpage, which I will drop in the chat now. That will be updated within the next couple of days. Additionally, this webinar is being recorded, and you can reference and share, come back to the recording at your leisure and connect the dots. We are also available at any time to continue the conversation one-on-one. If there's something that you want to chew on and think about, our contact information is on the website. Please use that, and we will schedule a call. Laura, did you have anything else?
I don't at this time. Just those of you who are users of the WISHIN Pulse system, we will be reaching out to your organizations probably beginning about mid-August to start your user transition. So you will be hearing from me or Keith or Cheryl to start validating your user lists, and then we will work on our side on a batch import and also get moving on the training sessions.
All right. Thank you all again for attending. We appreciate the time you took today, and look forward to seeing you tomorrow on the technical overview if you've registered for that event. Take care all. Thanks much.